No, stuff going on there. Okay, so yeah, I am Dr. Deb. I have been a pediatrician, a general pediatrician in Washington State for almost 30 years. I was in King County for a while. And then for the last year, I have been formally the program director for the Foster Care Center of Excellence that's housed in Northwest Pediatric Center in Centralia. It is in Region 6, for those of you who know about the DCYF configuration. I have specialty training in trauma. I am with one of the American Academy of Pediatrics trauma specialists and speakers. And I also am a specialist in walking alongside both children and adults who have had special stories, and stories sometimes including some adversity and some challenge. I've been able to put everything together, all of my training, my experience in the last year by walking alongside youth and families who have foster care experience. I met one of these families and was just really gifted when this person who is a foster care parent asked me if I would start talking about some of the needs and interesting challenges and successes that foster care families in the state of Washington have experienced. And one of those has been wondering how we can access, and do we need to access, naloxone for our families. Well, it so happened that in this last year, I have learned quite a bit of this, and I'm going to share with you just a little story. I call them all stories. I keep everyone's name anonymous, and most of these are just compilations of actual patients that I've encountered, not just in this last year, but actually in my entire career as a pediatrician. Tonight, I want to talk about why it matters. Why should we be talking about naloxone? Maybe some of you have a lot of experience with this. Some of you may not even know that, what it is. Some of us may have had to use this in the past. Some of us don't even know where it comes from. The reason I'm bringing this up is because generally, with the exception of some of us who have had to walk alongside those who might or might not have had naloxone or Narcan exposure, most families and most pediatricians actually have no experience with this and don't even understand why we need to have it available. I will share some of the just basic science about naloxone or Narcan. I will use those two names interchangeably, as well as something about the opiate and opioid phenomenon in our state, as well as in our country. We'll talk about some of the misconceptions, but mostly it's about how to access, how to use it, how to feel comfortable with this. I'll leave you with a whole lot of resources, and I'm glad this talk will be recorded because at the end, there's so many resources. And you can also reach out to me if you need any further information. Now, why does this matter? I'm just going to jump right to it, and then I'll give you some scenarios. In foster care, children often come from environments where they are impacted by substances. This probably is not news to a lot of us who work with those who are in care, but it may be that, we don't even know that this is happening. But actually right now, over 80% of child removals involve substance use by parents. That's actually nationally, that's why most children are removed from their parents, is because of substance use by one or more of the parents or guardians. Teens, as we know, are at an increased risk, both because of exposure and experimentation, and goes along with being a teenager. And caregivers and teens may encounter these accidentally, indirectly, or directly. But mostly I know that naloxone or Narcan saves lives, and that's why I want to give this talk tonight. So these are actual real life scenarios, and I want us to remember this and maybe call to mind someone that you know that may have already experienced something related to our subject tonight. There was a teen who came to me who said that at a party, someone tried a pill for the very first time. It turned out that it had been laced with fentanyl, unbeknownst to them, and suddenly passed out. This teen had to respond, and so brought the story later. It all turned out well, but this was a common scenario according to this teen. Some of us have also experienced, parent when they go for visit, when our youth go for visitation, or our children or our infants go for visitation, that a parent may have some materials around, or they may have relapse. This just happened to me recently, or maybe a sibling finds something at home. And recently a teen came to one of our providers and says, you know what, I saw one of my friends overdose and I want to get Narcan so that I know what to do the next time. Now this, and there's some hard stuff that we're going to talk about, but I want to first, really say with the hard stuff comes really a lot of the successes and hopes. And that's what I want to leave us with. This just happened. April, there was a boy who died in the care of his mother because of fentanyl toxicity. This is not, an unusual situation, but we really hope it's going to become rarer and rarer so that we know how to equip ourselves and equip our families. Now, overall, there has been in 2024 a downward trend in fatal opiate or opioid overdoses, with the exception of this group of people of color, the elderly and older Americans, Native Americans, Washington State youth. I'll talk about what's happening in our state, and youth in foster care. So everywhere else in our country, we're seeing fewer and fewer fatalities from opiate and opioid overdoses, except in these groups. And we'll talk a little bit about that. Now, in the general youth population in the United States, when youth are surveyed, these are the common substances that they admit to using. The number one would be alcohol, second is marijuana, no surprise. And then there's also stimulants and hallucinogens that they admit to. And overall in youth, not necessarily in care, about 20% of those youth admit to using one of these substances in the past year. In youth in care, that rate is about doubled. Almost 49% of the 17-year-olds and under have admitted to using one of these substances at least once in their lifetime. And based on certain criteria, and this is a definite diagnosis, about a third of them meet the diagnosis of a substance use disorder. Now, one thing to know about these statistics is that they're generally obtained for youth in schools. So if they're not in schools, or if they're only in schools occasionally, they may not have been a part of this data collection. So the number may be a little bit higher for youth in care. Sorry. Now, what is it about youth in foster care that may have these higher rates than the general population? In 2024, my own specialty published a study that showed about 40% of youth in foster care versus 21%, so double the number, reported some form of substance use in the past year. So this is recent use, not over their lifetime, but in the past year. And about 45% reported using it just recently in the last 6 months. Now, this includes alcohol and all those other substances that we were talking about. And again, these youth were captured in school settings, in detention centers, or anytime that they were surveyed when they were in a place for quite a bit of time. In our state, children in foster care, now this is compilation data from the last 20 years. I couldn't find more specific. These I tried to find from the last 5-6 years. And so these are the latest numbers. Children in foster care, of those that we can survey, alcohol use was the predominant use, marijuana second, stimulants such as Adderall, other ADHD meds, heroin. Now here's that opiate use. Now the number is so variable, and if you add these up, it doesn't add up to 100%, but we're pretty close because, as you know, some youth, we cannot capture their usage when they come in, but this matters as to whether they have the age group. So the older they are, they're more likely to have been exposed or experienced this. The younger they are, it may be a little bit lower. And the reason it is getting to be a little bit more concerning is because of the amount of counterfeit or fake meds out on the street. And this is, I don't know if you've seen this, this top slide is OxyContin. If I were looking at this and with my bad eyes, I don't know that I could tell which is real or fake. This is the counterfeit one. This is the real one. Looks pretty good, huh? And up here, this is Adderall. Again, the counterfeit and the fake, and the real look pretty good. And this is Xanax. So out on the streets, when some of our youth, whether they're in care or not, are probably, maybe they know somebody who's trying to find an Adderall, or maybe they're hearing somebody who has an oxy with them. They may or may not be getting the real thing. Chances are, especially in Washington State, they're not getting the right, the actual medication, and it's most often laced with something that they didn't intend to be ingesting. Now I'm going to shift us over to the opioid use, and we'll talk about this so we can set the stage as to why it matters in Washington State, especially in our foster care system, to have a remedy for what's happening. Every week, as far as from 2022, the last days that we had the most comprehensive data, the equivalent of a high school classroom's worth of students, about 22 young people died of drug overdoses in the United States. This number has not changed. In fact, it's crept up a little bit up to 2024. Right now, pediatricians and the CDC have classified drug overdose as the third leading cause of death in pediatrics. It's 18 and under, only behind accidents, trauma. And Washington State, sadly, is double the rate of opioid fatalities in our young people. This is based on the University of Washington statistics. So whereas other states may be seeing a little bit of a decline in our adolescent population, Washington State is still seeing a rise in it. So it matters quite a bit in our state. Now, before I continue, you're going to hear me say opioid versus opiate. And then this is just for you scientists or healthcare workers, if you want to know about it. If you didn't already know, opiate is the natural form. It comes from the opium poppy. From this natural form, we can people have extracted morphine and codeine. This is natural. So scientifically, in research papers, you may see the term opiate. Opioids are synthetic, meaning that they are made in labs, and they are trying to they take the same opiate or natural form of the chemical and make it into pills, make it into medications, things that you know about. Now, for our terms, you're going to hear me use opioid most of the time, and that's what you'll see. But it also includes this, which is natural. Now, a word about these others, which are called psychedelics and psychoactive drugs. Psychoactive drugs are anything that does alter our brain chemistry and behaviors. Think of things such as antidepressants, medicines for anxiety, ADHD meds. Psychedelics, mushrooms, MDMA, ecstasy, ketamine, which are also mixed in with a lot of these things, work differently than these opioids, but they do affect emotions and perceptions and how we perceive. In young people, though, when they are seeking to just feel better and perhaps have an alternate view of the world, they're looking for this, but they're often getting this, and that's what matters. Now, this is a very complicated slide, but I want to try and explain what we in healthcare are looking at. We're talking about waves of fatalities or deaths due to opioids. Now, the first wave was back in the 2000s, and that was mostly at the hands of us in healthcare. We were overprescribing opioids because we didn't want you to be in pain. And so people so this is the green line. We saw a little blip when people were getting a little bit extra medicines because we weren't very mindful in healthcare, but now it's stopped. We took out the measuring fentanyl because fentanyl has always been a prescribed medicine in certain, like say, operations or post-operative care. In wave 2, which started about the 2010, that's that purple line. Suddenly there was a rise in heroin use, and we started to see some fatalities until the heroin, this was both due to national campaigns, but also people were trying to stay away from heroin, and they were actually starting to do some remedies and try to prevent the overdoses. The third wave, which began around 2013, is when we started seeing more fentanyl. And this was actually pure fentanyl that was being manufactured both out on the streets, but they were also trying to get this from legitimate healthcare workers. And the rise, as you can tell, since 2013 has just skyrocketed. The thing that we are living under is called wave 4. Because not only are we seeing all of the rest of the opioids, but and fentanyl, but now we're seeing it mixed with other substances. I don't know if you can see that. And this is we don't know when it's going to end. But right now, the big problem under wave 4 is that we're seeing polysubstance use with a lot of fentanyl in it. Now, what's so significant about fentanyl? Here is just a general chart. I don't know how much you can read, but right here is morphine. This is what was used primarily for pain in most hospital care settings. And this is what we classify as something as strong as morphine or weaker than morphine. Here's all those, codeine is down here, tramadol is down here. We climb up this to where the most potent opioids are, and this is where we get to fentanyl. Now, fentanyl, which is normally about 80, maybe 8, in medical situations, about 80 times as strong as morphine on the streets, add a 0 to that. We're now seeing fentanyl, which is up to 1,000 times more potent than morphine. And there's even one that's even stronger than this. It's a veterinary medicine that we're actually now seeing. It's used to tranquilize elephants and large animals. We're seeing even that out on the street. So the fentanyl that was in our hospitals before is nothing compared to the fentanyl in the streets. And this is important to know. It takes about 2 milligrams of fentanyl. This is about as much as fentanyl would look like. It's the tip of a pencil, enough to kill an opioid naive person, which means, think about that teenager that I said who's tried a pill for the very first time. If they had even a fraction of this, their body would probably respond very negatively, and it could be enough to kill that person. This is not very much. One thing to know about this is that when those who manufacture the drugs that are on the streets illegally, they're taking this fentanyl stuff and they don't mix it very well. They call it chocolate chip effect. And that sometimes one pill will have just a few grains, other pills would have a lot more. So even in the same batch, you may see different concentrations of fentanyl. And so that young person who's taking one pill versus their friend who's taking a different pill may have actually a different concentration of fentanyl. The other thing about it is that if it's manufactured, if say these drug manufacturers illegally are manufacturing other drugs, but they've already prepared fentanyl, it could still have the residue of that fentanyl and go into the pill, say Adderall or Xanax. Troy Wasserman, he works for DCYF and he works in the, he's a remarkable person. I haven't met him, but I love what he does. This is a quote from him. Fentanyl is as lethal as gunshot wounds or getting run over by a truck. And overdoses are more common than fatal car accidents. This is in our state of Washington. And he sees this. He's the one who's helped develop his team, our opioid educational system. And we're hoping that it'll just expand throughout the state because we're seeing the absolute devastating effects of the opioid epidemic in our state. Now, specifically about those deaths. I talked with a family once who said, oh, this is not a problem because they don't, my young person, whether they're in care or not, they don't do this kind of stuff. And besides, when they go to their room, they're pretty safe. Well, sadly, in Washington State, the last, when we looked at the overdose deaths of our young people, the majority of them occurred at home, about 2/3 of them. Bystanders, family, guardians, they were not aware because those youth went to a separate room. And they were not even aware of the drug use. Naloxone, wonderfully was used in about 1/3 of the cases, but we want to get that number a little higher because of the problems out there. So just again, why are youth in foster care at such high risk? Now, primarily it's because youth come in the system with other conditions and concerns. So if the youth already has other conditions or concerns, they are at an increased risk as PTSD or conduct disorder. That does not mean if a youth has these diagnoses, they will be using substances. But in my line of work, if you've had some form of adversity or traumatic event, and 100% of our youth in care have, I'm going to be mindful of what they're going to use to deal with the pain and the trauma, so to speak, of what they've been through. And I'm not going to be surprised if they said, some people have told me to do this to get rid of the nightmares, for example. We do see higher rates of youth living in independent situations, such as the group homes or once they transition. It is, as I said, a form of self-medication for trauma and the pain of any kind of mental illness. Now, in my clinic, I really try and pay attention to the whole story. So I want to listen to whatever the youth and the family want to share with me. But often there is this post-trauma scenario, and if I hear about the way trauma is living out in their bodies and in their lives, I want to pay special attention and find healthier ways for the youth and the family to work through that pain. And there is a strong correlation between peer use and youth in foster care. I do work with youth who are in group homes, and I do see that if someone has had experience with opioid use, and the others may be a little more curious, but there's certainly some strong correlation with one youth influencing another. And sadly, many youth in care often begin their substance use experimentation at a rather young age. But other things to consider, and we talked about why some of those minority people of color, other cultural groups have a higher rate of exposure and adverse or bad outcomes. And it sadly is exactly what I see. In certain communities, there are higher rates of use and bad outcomes. And then we also know in order to heal from trauma, you need to have that safe, stable community, and oftentimes the families themselves or other, the environment may not support recovery and return to health. And this is where all of you wonderful foster families come in to help with that. Now, just real briefly, so we see these all, what to look for if there's an opioid overdose. The one thing about, and you can look, yes, they cannot be woken up or they're not moving, they're breathing. This is where the opiate especially affects life because it suppresses breathing. They are cold or they can be purplish. They may be disoriented. Their pupils are very small if you get a chance to look at this. Teenagers or young people or other youth in care, what I'm trying to help them see is that if your friend is asleep, try and wake them up. That's the key. Don't let them sleep it off because you don't know what it's from, because it could, you don't have to look at their breathing, just try and wake them up. That's the advice I give to everyone. So kind of tough news right now, but what can we do? There are things we could work with, and that's why I'm asking us to consider naloxone or Narcan. Narcan is a brand name. And so maybe some of you have a lot of experience with this, but as means of review, naloxone, it comes in all of these forms. A nasal spray is what's mostly available, and I'll talk a lot about that. It does come in different forms of the nasal spray. It does come in an injection, even an auto injector. Most of the homes, we recommend having this nasal spray, and it works. It reverses opioid overdoses within 2 to 3 minutes. Very easy to administer, very quick. Anyone can carry this. And so this is the form that you're going to see most of the time. All forms safe, easy to use, and they actually have no effect if opioids are not present. It's okay to use it. If you took it, if I took it, depending on whether we had a cold medicine or something, we might notice something, but generally none of us would notice anything. And then briefly, just how it works and why if you've ever administered this, why something would happen very quickly in the person if there was an overdose happening. These are the opioid receptors in the brain. And it's made specifically for opiates. We talked about the natural opiates, but we also have those, synthetic ones, the medication. They fit perfectly in these receptors, perfectly. And then naloxone comes along and it pops them out. And it pops them out so quickly, very efficiently. So whereas here, there's a lot of, people use some opiates or for pain relief or euphoria, immediately that gets popped off. Well, immediately, if there's pain, it'll come back. If there's any euphoria, it will go away. And it's a pretty sudden, complete reversal, which is actually what we want, especially if their life is in danger. But that's why some of us will see those responses of somebody who has come out of this that all of a sudden they will not be very happy, but at least they're alive. Is it safe to use? Absolutely. It has no potential for abuse. It won't hurt you if it's administered and it's from, say, alcohol overdose or poisoning, and the person is, intoxicated from that. It can be used on adults, teens. I've used it. Well, I haven't, but some of the infants I've seen have had Narcan and naloxone administered. The key here is always, always activate the emergency system. This is what we tell the teens. Call 911 before you do anything else. And this may not be for this audience, but I sure hear this is, why do I need it in my home? We're not a drug home. We don't use it. But because remember that first one of those statistics is that you don't even know if somebody's using it, or it could just be a one-time use. You need to be prepared. So it's not encouraging drug use. In fact, a lot of the evidence now nationally, worldwide, is showing that by using some words, by talking about it, we're actually discouraging the use of drug use. And I'll talk a little bit about that later. Well, I don't know how to use it. It's scary. There are so many ways to learn how to use it. It's free. We can get you more information. We hand out Narcan in my office. It's a very quick teaching. We teach families and teenagers. It's very easy, and people really appreciate having that on hand. So again, what I said about what to do if you suspect an overdose is try and wake them up. Try and wake them up, activate 911. If you have naloxone or Narcan, spray it into one nostril. And then if CPR needs to happen, you can do so. This is just by safety. We do talk about this with teens. A lot of teens are saying, well, I'm not going to be doing those chest compressions. I said, you don't have to. You gave the naloxone, you called 911. You did your job. Let somebody else come along too. If you know CPR, then go ahead and start that too. Now, here in Washington and in most states across the country, naloxone is covered by Medicaid and most insurance companies. The only one that really doesn't is Medicare, but you can write to Medicare, or you can tell the pharmacist, I have Medicare, and even they will make an exception and give that naloxone out in pharmacies. It can be dispensed without a prescription. If you go to the standing order, and I'll show you where that is, pharmacy should be able to give this to you. Now, in Lewis County, we've already tried. It's not easy. But what we're doing is now giving them the standing order that comes from the Department of Health, so that anyone, including a teenager, we usually encourage them to go with a parent or guardian to get naloxone from their local pharmacy. We need to re-educate and educate our pharmacies as well that naloxone is available for everyone in the state. And then where do you get the training? This is where I would start. This is our Department of Health here in Washington State. All of this will be in the resources and references, and they'll have a QR code in a little bit that you can capture. But this actually under their you and your family and all in the overdose and education will go step by step, as well as videos and other resources where you can learn how to use it. You can come to our clinic if you're ever in the area, and we'll show you how to use it as well. Now, a little bit about the Good Samaritan law here. Some families have said, there's no way I'm going to do this. What happens if I get in trouble? Or if we're at a party and we're all, we're not supposed to be, having alcohol or anything. The Good Samaritan law, as it stands in Washington State, is that if you get medical help for an overdose or for alcohol poisoning, that you or the victim cannot be charged for drug use, possession, or underage drinking. And I'll go through this a little bit more, and I'm going to start emphasizing this more with teens and their families. I say never let someone sleep it off. Wake them. You could be saving their lives. This is the statute, the Good Samaritan law, and it protects anyone, adult or minor, for seeking help during a drug overdose. It's designed to save lives. As long as you call 911 in good faith, you stay with the person until help arrives. If you have naloxone, give that, and you or the person will not be charged with possession of drugs if you followed all the rest of this. Now, have I heard of people getting in trouble? Yes, because it doesn't protect you if there's an outstanding warrant, and I'm very honest with people. If you were involved with drug trafficking, or if there were other crimes committed at the time. Most of the time with the minors that have been, that I know of that have been involved in this, they have not been charged with anything else because they were doing their best to help somebody else's life. So I've seen judges really be lenient on this as well. Okay, so we talked about Narcan, naloxone. We talked about, how to get it, how to become educated. What I want to couple this with, it's not just about having this on hand. It's not just about saying, here, teenager, you must have this, or school. It's also about what we can all do. And that's what we're all here for. I am so grateful to all of you who have welcomed a child into your home and your heart and walked alongside them for whatever time they're with you. And I consider this all what we do, this, whole child holistic system of helping our young people, especially those in care and who are very vulnerable, have the healthiest life that they can. And so we want to make sure that there's trauma-informed care, that we start early and that we walk alongside them. You got to remind us health professionals that we need to talk about this with our teenagers, not be afraid of it, and not be afraid for, not let let the teens find a safe place where they can talk about if they're, have experience with any of these drugs or substances. We need to make it so that everyone feels safe with who they are and who their story is. And I'm going to, mention this one, which is the Alcohol, Drug, and Addiction Institute out of the University of Washington. They've come up with this really nice handout. It's a guide. You can get it online. It's also listed in my references, in which we're trying to turn the narrative, turn the story about how to support our young people if they have experience with opioids or fentanyl specifically. The key is there's just two things. The key to recovery, the key to sobriety, the key to health is staying connected with someone. Many of those who have the story of experience of needing opiates or fentanyl have said that their key to recovery was people didn't give up on them. Now, the best people would be people that they trust, maybe family or friends or community. Those of us who work with foster care kids, and that's what I've told a lot of the caseworkers is, we are their family. We're the ones who are going to help them walk through this. We're the ones that are going to not give up on them. So we have to be that community for them, that healing, accepting, and nurturing community for them. But we're real concerned about their health and safety. If you can, I would invite you to look at this. I'm part of a learning collaborative with the University of Washington where we're, looking to see if this is the best language and, and ways to talk to our young people and families, because we really want to make this an open conversation for those teens to have a safe place to talk about what they're experiencing and their struggles. And there's that website. So if you want to, snap that, but it's also in the recording, is our Department of Health. I would actually start with that. And then from there, you'll find great links to training, how to get naloxone, how to get that standing order, how to find naloxone or test strips near you, how to find other resources. So I really like this website a lot. And so this is going to be a pretty quick talk. So, why am I saying that foster homes need the Narcan or naloxone? It's so that we can be prepared, because these emergencies can happen anytime. We want to provide that protection. Now, it's not necessarily harm reduction tool, but we can go into a discussion if we want to later on. And it's not an endorsement of drug use. It's just to protect the young people. And then there's peace of mind. It equips caregivers. Imagine if you walked in, or your friend, this is what I'm telling teens. Imagine if you're at a party and someone goes down, you get to do something while you're waiting for 911 to come. And so what else can we do? Policy and advocacy. Talk to your schools. There are some schools across the country that actually not only teach CPR and basic life support for their teens, but they're also teaching them how to use naloxone. So it goes hand in hand, because they understand the teens' environment now. And those teens are forming leadership teams and saying, we got to teach every one of our classmates and others. And then get educated. Find out more about what naloxone is, find out maybe a little bit more about the substances that are out there, and then what these young people might be exposed to. Now, some states require naloxone in some schools, so why not in foster homes? And, encourage agencies, to include, naloxone in all of our kits, offer training like we're doing right now. Get more training, get everyone, to at least understand what's out there and normalize where I said, harm reduction conversation in our care plans. This was, a couple of years ago, but a whole group of Colorado teens, they, a friend did die from an overdose, and they went on to create laws in their state so that naloxone teaching and supply was available to any teen that wanted this. So it was just a group of teenagers that decided they were going to, respond to their friend's untimely death, and they were going to turn it into something good. So my final thoughts. Narcan is like having a fire extinguisher. You hope you never use it, but it can save a life. It empowers caregivers and the teens with tools and trainings to respond to a life-threatening emergency. And it lets us be proactive, not reactive in protecting youth and care. And so I leave you, let's see, sorry. So here are some really neat things it's actually from the Department of Health website, because I do have some families, well, I don't know how to start this conversation, or parents of any youth, it's like, just ask some of these questions. Have you heard about drugs getting laced with fentanyl? What do you know about fentanyl? Do you know what an overdose looks like? These are, questions any adult or, caregiver can ask a young person. Do you know anyone that might have been using fentanyl or other pills? You don't have to tell me who. I just want you to be prepared to help them. And then, what are your thoughts about carrying naloxone just in case? And then I'm here to listen. There's no judgment here, ever. Talk to me about anything. So if we go back here, maybe we can open it up for a little discussion. I'm ending a little bit early, but how would we help this teen? How would we change the situation? What could we tell this teen, what to do? How would we help, during visits? How would we help ourselves? How do we equip siblings? And what do I tell that teen who said, I want to be able to carry this? Can you help me get this? And finally, here are all my many, 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 these are recovery resources, opioids, overdose and treatment. And finally, all of our resources. And that's it.